Let's get into this case study. You're dispatched to a general illness for an 8-year-old. As you respond, dispatch upgrades a call for emergent response for a stroke. The dispatcher advises you that the 8-year-old male is having slurred speech and numbness to the side of his face. You find the patient sitting on the couch, alert and oriented. So just the side of your face is numb, that's all? Okay. So you can't feel one side of your face?
No.
Do you feel this?
Yeah.
Do you feel this?
Not really.
Not really? Okay. What about up here? Do you feel this?
Yeah.
Do you feel this?
Yeah.
Okay, good. Follow my finger, adjust your eyes. Boop. All right, now smile real big. Show me all your teeth. Good. Okay, stick out your tongue. Good. Can you swallow?
Yeah.
Okay. Cool. Can you give me a high five with each hand? All right. Does anything hurt?
No.
Nothing? Okay. So with that assessment, you found the child to be alert and oriented with a GCS of 4, 5, and 6. His airway is patent, he's breathing normally, his skin is pink, warm, and dry. But you do notice that asymmetry to his smile. And we can also see that in his eyes, we've got part of this eye that doesn't want to squint as much as this side. So when his facial muscles move, it's really only moving to that one side. He's in a clean, well-kept environment. Vitals are shown, a heart rate of 103, 97% on room air, blood pressure 96/60. He's afebrile, blood glucose is normal. So his lungs are clear and equal in all lobes. His abdomen is soft, pliable, symmetric, and non-tender. He has no medical history, no known drug allergies, and his parents validate that he's had no recent complaints or ailments. So you're asked, what is your differential diagnosis? What additional assessments would you perform? And overall, what's your plan of care? So we'll start with what our differential diagnosis would be. So we're dispatched to a stroke, presenting with some stroke-like symptoms. So we're kind of starting there. All right, well, the only thing that we have found is, asymmetry to the child's face. And then we sort of think, well, the likelihood of a child of that age having a stroke, very, 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 very rare, not completely out, but still possible. Okay, but we don't have anything else. So, aphasia, nothing is off there. It's pretty much just focalized there. So there's no altered mental status, no hemiplegia. So none of those things are there. All it is just the face. So we can kind of start ruling this out. Well, then we think, well, what else could cause the side of the, one part of the face to not work? Well, that could be a focal seizure, focal or partial seizure. Well, it's not working. It's not like it's having its tonic moments of, contraction of the face, because that would be very indicative of a focal or partial seizure, as if just one part of the face was starting to move or having those tonic tensioning up faces, but it's not. So we can kind of rule that out as well. I'm like, well, diabetes can most definitely mimic a stroke. Well, we checked blood sugar and it is normal. So we can kind of rule that out. Then we're left with Bell's palsy or Ramsay-Hunt syndrome. Both can present as just having that asymmetrical face. Okay, the only difference between the two is really the underlying cause, what has caused that facial palsy. So let's dive into these a little bit more. So Bell's palsy, Ramsay-Hunt, again, because of that facial palsy is really what the difference between the two is. Where you can see the long laundry list of things that can be caused or that can cause Bell's palsy. Okay, so, but we know chickenpox, shingles, the herpes zoster virus is for both of them too. Okay, so both can cause Bell's palsy. And then other long lists of, Epstein-Barr, rubella, measles, mumps, influenza, all those things. So a lot of this can be prevented by, vaccinations, inoculations. So reduces the likelihood of these occurrences, but still can occur. So what we'll notice here is with the shingles is if that does occur, it's generally going to be with that like shingles outbreak. So in that Ramsay hunt, there's the associated sores that come out with shingles, and shingles cause that inflammation and irritation of the nerves, so it's painful. And so if they've developed a rash, and a lot of times this occurs near beginning at the ear, they'll have a rash on the side of the face, around their ears, and then it gets in and irritates that facial nerve, is going to be Ramsay hunt. Other things unassociated, going to be directly Bell's palsy. Another common thing, not necessarily a virus, but is Lyme's disease. So Lyme disease caused by the deer tick. And things you would see here is it's going to be like a bullseye where the tick had buried its head and bit, and then red outer rings, going to have that bullseye look. Okay. A big common cause is that Lyme's disease caused by the deer tick in North America, kind of the mountainous northeastern region, and then some found in the southern part. And ticks can be found in a variety of areas, so just knowing if a tick population is prevalent in your area. So Lyme disease and those viruses, probable causes for Bell's palsy. And again, Ramsay hunt, going to be attributed strictly to the shingles virus. And so what's going on, with shingles, it goes in and affects the nerves. Okay, so with both of them, what is happening is a virus has went in and it's caused inflammation. Okay, and where the Ramsay hunt comes into play with the shingles, again, is having those rashes like around the neck, the ears, the jawline, and it gets in and it gets to this facial nerve. So it gets that facial nerve, and then it makes the signals from the nerve pathways not work. So then this half of the face is not going to have any sensation or been able to really move. And Bell's palsy is kind of the understanding of the nerve runs through a small orifice. So if this is your nerve going through that orifice, well, when it becomes irritated and inflamed, it makes that nerve swell. Well, then that nerve swells, it pretty much fills up the orifice, becomes constricted, and then those nerve signals are not able to go through to the respective areas of the face, causing that facial palsy. Again, our presentations between the two. So Ramsay hunt gained a lot of popularity by Canada's favorite child of Justin Bieber. Okay, so Justin Bieber, as you can see, this side of the face, able to smile, able to blink. This side of the face, unable to really have any type of movements. So in like interviews that he did, when he would talk, only one part of his face would be moving, and it was attributed to shingles. Okay, and Bell's palsy, gonna present, same way. Asymmetrical shapes to the face. So management in pre-hospital setting, it's going to be supportive care and very good assessments, being able to go in and detect whether this is a stroke or suspicion of Bell's palsy, and getting them to a facility that is able to do blood paneling so they can see what type of virus it is, to be able to give the respective type of antibiotics, and then steroid treatment. The good thing is there is a very high return to normal within these patients within about 4 to 6 weeks after they've had extensive antibiotics, stopping any other spread of the virus, and giving steroids, helping with those inflammation of those nerve pathways, and then possibly rehabilitation, because you think we've been at the point where some of our facial muscles weren't working for a while. They could have developed some atrophy, so they may need just muscular exercises to restore muscular tone in their face, possible speech therapy, just regaining the use of the muscles that weren't working for a little while. So thanks everybody for tuning in. Hopefully able to pick up some stuff in this within, facial palsy as it would relate to Bell's palsy or Ramsay-Hunt syndrome. So remember, Bell's palsy is a thing that can just resolve on its own and generally caused by some type of virus. Ramsay-Hunt caused isolated by chickenpox and shingles. And Ramsay-Hunt will generally begin with some type of presenting sore and painful rash. Bell's palsy can just randomly appear undetected and without any other type of attributing symptoms. So thanks for